So you hear me frequently talking about taking blood tests before I'll start any patient on an oral antifungal medicine. And I know not every doctor does that, but this patient will show you exactly why we do that. So listen to the conversation and you'll hear about some abnormal results and what happened when she followed up with her primary care doctor. So she's no longer a good candidate for these medications. She's got a couple really great nails. The rest are pretty average, but you know, that's how it goes. So I hope that you enjoy our video.
They didn't grow much today, or this time.
Well, they grew enough to cut. Yeah, did you just get your hair done?
No.
Oh, okay. I thought I smelled hairspray.
Well, there's probably some little hairspray in there.
Oh, okay.
Yeah. Okay.
All right, so when we were talking about doing antifungal therapy and we drew the labs, your liver functions were elevated, and so we did not start the medication and you were going to go see your primary doctor. So what happened with that?
We ran the labs again, and they were elevated.
Okay.
We did an abdominal ultrasound. No signs of cancer or anything, but fatty liver disease.
Okay.
And 2 gallstones.
Oh.
So we're just holding the pattern now.
Okay.
We'll retest again in 3 months or so.
Okay.
But I assume we can't go on that medicine. We can't do anything right now.
Right, exactly. And with fatty liver disease, you're not a great candidate to go on it anyway.
Okay.
So we have a couple of choices. I mean, we can try to treat it topically.
Okay.
We can find someone who's doing laser treatment of fungal nails.
Okay.
They're out there.
Okay.
And they're always running Groupons,
Okay.
you know, so that's an option.
Sure.
Some people would rather just come in every few months like this and have the nails trimmed and thinned out, and that's plenty. Or the nails can be removed. So,
I've had them removed once.
well, I mean, removed permanently if they're
Oh, you're talking, yes.
if they're painful.
No.
And
They're
so,
not.
yeah. So those are kind of the choices.
Do you have any that you would recommend, or is it
Well-
up to me totally?
Well, no, I mean, when we were doing the laser got about the same rate of improvement as the oral medications. We stopped doing it just because we don't own a laser, and the company we had been using changed their payment structure, and it wasn't viable for us anymore.
Sure.
But we could probably find somebody for you who's doing it.
Okay.
You know, a topical medication, because the whole nail is involved and the fungus is now back under the cuticle here,
Mm-hmm.
where the nail grows from, a topical probably is not going to work if our goal is to get rid of the actual fungus in the nail.
Okay.
Because the nail is now being produced back under here with the fungus already in it.
Sure, I understand.
So, you know, if your goal really is just to stay comfortable, then I would say the routine trimming of the nails is a fine way to go.
Okay.
If your goal is, let's see if we can get rid of the fungus, then I would say, let's see if we can find who's doing the laser treatment for the fungal nails.
Okay.
Because you're the ideal candidate for that. Of course, that's not covered under any insurance,
Okay.
so it's all out of pocket.
Mm-hmm.
And,
Well, they don't hurt at all at this point.
okay,
So, since I've worked on this for, I think I just prefer to keep them trimmed good.
okay,
And, you know, if there's a problem or something, I can do something else. But I've tried some of the topicals, and like I said, I've had the nails removed, the nails removed twice, I think.
mm-hmm,
Not permanently, you know.
right,
And they come back and seem to be better for a tiny bit. And so my plan is, from this fatty liver, I guess, is it's weight loss, exercise, healthy diet. So I will be seeing a nutritionist again. and attempt to do some of that. And,
Now,
but-
is that something that can be reversed?
yes,
Okay.
it can be, I don't know completely, but it can be helped.
Anybody else in your family who has that?
I don't, not that I know of.
Okay. Well, and this is why we do the blood test before starting the medication.
Yeah.
You know, imagine if we had just put you on the medicine
Appreciate
and made
that.
everything much worse.
Yes, yes.
Now, did you know you had any liver problems
No,
prior to that?
this is the first time I've had any numbers. They run pretty comprehensive,
Okay.
metabolic panels and
Yeah.
because of my other things, but
Well, you know, and if you're coming in every few months for us to trim these,
mhm.
you know, it'll be nice. I'll get to see you.
Between me and you'll have more than you need from us. They get so darn thick, don't they? And
They do.
hard to cut.
Mhm. Well, but you need the right tools and the right
Mhm.
vantage point, which I have both
Oh,
right here.
yes.
So, um,
And is some of what you're doing now thin them out too?
Yep.
Okay.
yep, absolutely.
So I'm gonna go back. When you asked about the hairspray, is that for an allergy reason?
No, I just
Oh,
smelled it.
You just smelled it, okay, yeah, it's probably this.
Yeah.
I'm gonna say, I'll be careful I don't use it if it's.
No, it's not a problem.
Yes, for some people it is.
I just thought you'd be really impressed if like you just came from the salon and I just kind of figured that out. You're like, wow, is she psychic or something? Now, if you think about it, I'm sure perfume and cologne sales have like plummeted in the last 10 years.
I would think so. I would think so.
I mean, people used to wear it everywhere.
Yep. And lots of it.
Yeah.
I mean, no, they just use Axe body spray.
Yeah. I mean, does that have scent or no?
Oh, yeah.
Oh.
Yeah. Middle school boys douse themselves in
Ah.
it. They treat it like a shower.
Kind of what they used to do with Old Spice, huh?
Mhm.
All right, so I'm gonna do all the little toes first and then I'll come back to the big toes. those should be a lot more comfortable.
Great, yes, they look better too.
And you put some nail polish on.
That's right.
Nobody will notice.
See, I can tuck Sean into doing my toenails, right?
Well, good. So I'm glad that you're making strides on that.
Yes.
You know what's going on with the
Yes.
liver, and that you guys are on top of it.
Yeah, thanks for, being as diligent as you were and letting me know. And,
Yeah.
I don't know what they do if it continues. I'd probably look into the meds I take, and like I said, supposedly if I do some weight loss, it'll help too. So.
What doesn't that help?
Every single thing. There's two things. Weight loss is always the first, and every disease has cancer as the last thing. I read a lot on the internet now, and I found those two things out.
I had a friend who was diabetic and severe arthritis who had a bariatric surgery. I'll take your socks.
Oh, sorry.
And, she ended up getting off all of her diabetic meds and all of her arthritis meds. But those surgeries, according to Dr. Now on my 600-pound life,
Yes,
only has like a 5% long-term success rate.
correct.
And of course, she gained back everything
She did.
and is back on diabetic meds and arthritis meds. And
So it is true that it helps everything, right?
Yeah, absolutely.
There you go.
all right, well, thank you for letting us do
Thank
the
you.
video.